I'm just going to run through a little bit of housekeeping. Can I have the next slide, please, Sarah? Okay, so as I just mentioned, if we can ask you to mute yourself throughout the session, just to cut out the background noise, that would be great. You'll see a toolbar in front of you. If you can also click on the video button to switch it on and off. The webinar is being recorded and we'll make that available to you afterwards. So I know, Kerry, you mentioned that you've got to leave early. Anybody else who's got to leave early, we'll make sure that you can watch it at a later date. And also the slides will be sent out to everybody. Can I have the next slide, please, Sarah? And that's what your toolbar looks like. If you hover over the screen, it will come up. And then the third button along from the red hang up button is the chat button. If you press on that, you'll be able to see the meeting chat that's going on, which will be shown in a column on the side of your screen. So any questions you can post there. Next slide, please. As I just said, that's the chat button. In terms of questions, feel free to post questions as we go. We will have time after each of the speakers for a couple of questions, and then we will also pick up at the end of the session and have more of a collaboration session, sharing good practice, any queries, ideas and what have you. If there are particular questions that you think are really good, if you can like them, if you right click over that and like it, then it will kind of give us an indication of how important that question is in terms of prioritization, that we make sure that we follow them. What we will do is we probably won't have a chance to answer everything today, but we will show you later on in the presentation what we've done with all the information that we collated last time, and we'll continue to do that going forward. Okay, next slide, please. So the slides will be shared after the webinar. Please contact our email address if you didn't receive them last time, and then we can also make sure that you're on the distribution list. We'll also resend the link to the recording of webinar 1, and then we'll also share the link for this webinar as well following. Next slide, please. Right, I will pass over to Jenny Walsh, our clinical lead, and she's just going to run through the agenda.
Hi everyone, thanks for joining, and I hope you're all keeping well out there. We've got a packed agenda today, so what you'll find as we go along is that some of the slides, we won't talk to all of them, but we just make you aware that they're there so that you can refer to them as you need them. So we're going to start with a national and regional update, which Liz is going to lead on. Then following on from your feedback last time about lots of people were sharing concerns about looking after women who are pregnant at this difficult time and managing their expectations about their labour. So we're delighted to say we've got Abby Applin speaking from the Royal College of Midwives. And then also not forgetting our third sector, which is so important at this time. We're also delighted to welcome Becky Saunders and Liz Rowe from Home Start next to look at the Home Start offer during COVID. One of our great third sector partners, and it'd be really interesting to see how we can link in to support families using that brilliant resource. We're going to look back at the feedback we got from last time and sharing that, but again, some of that we might just sort of skip through a bit. The really important bit, I think, collaborative session towards the end, which is about sharing any difficulties you've got, to see if somebody else out in the community, in our big community here, has got solutions. Also learning from best practice and any other questions that you want to ask of the speakers, because they'll be with us until the end of the webinar. So without further ado, let's move on to our national and regional update from Liz.
Thanks, Jenny. So just to update a bit further from our webinar a fortnight ago, so we had already established various meetings both across maternity and perinatal mental health as a regional effort towards COVID-19. In the last couple of days, at the end of last week, the regional team have been asked to formally establish a maternity cell, which will include perinatal mental health and neonates as well, across the southeast. And this is really a formality more than anything else. So the meetings have already been set up. So we have weekly meetings with the neonates ODN, weekly meetings with the heads of midwifery and the directors of midwifery, regular meetings with the LMS PMOs, but it's more a formal establishment in terms of the governance and also the recording of any issues in that. And you'll see there's various that comes out from the regional team currently collecting the data in terms of our COVID women and babies within our services. So that will continue. So each of your services will be involved in that, and we also have links obviously to the Southeast Regional Mental Health Cell, which has mainly had more of a focus on adult mental health, but perinatal mental health also feeds into that. We have got, can I just ask anybody who's joined, can you make sure you're on mute, please? Thank you. We have got the National Perinatal Mental Health Clinical Network meeting on Friday, which we will be joining. That's a really great opportunity in terms of two-way information sharing. Jenny has weekly clinical lead meetings with the national team, and so various things that we've picked up from the webinars get fed back to that. And obviously any information that we have from there, we will feed back to you and cascade. I think it was last week, or it might have been the very end of the week before, we did a very quick staff survey in terms of redeployment of staff, and that was completed in the Hampshire Thames Valley Wessex Thames Valley patch for Dorset, Hampshire and Thames Valley, and returned to the national team. And we've also shared that survey with our Kent, Surrey, Sussex colleagues that are on the call, so that you can also fill out. It's just really an idea to get an indication of whether staff will be redeployed, or likewise for some of our services that actually we're having additional staff coming into bolster perinatal mental health services currently during the COVID period. Next slide, please. So one of the things that's come up, and we've had feedback from many of you, is about the reporting currently. And so there has been a statement that was sent out from the National Perinatal Mental Health Team. You will have this in your slides to read in full. I'm not going to read it out, but I've just picked out the key highlights. So the important thing is that the assurance and additional or bespoke reporting requirements over and above routine data collections are paused temporarily until further notice. And I think that's really important for services to know that. There will not be any additional asks currently. However, all service activity within the specialist perinatal mental health services should continue to be captured and submitted via the mental health services dataset. So that's part of your routine reporting and will inform the access metric. So that continues in line with the access metric, but anything additional will be temporarily paused until further notice. Can I have the next slide, please? Now, many of you have been in touch with us about whether telephone calls can be recorded and be counted as part of that data. And Jenny and myself have been in various discussions, as have the regional perinatal mental health team, to ask that with the national team. The statement that has come out has said that that will not be counted. They're standing by, what they've said to date, and that is not being amended currently. So the access to services is defined as women who have had at least one attended contact, so that's face-to-face or video conference Skype contact with a specialist community perinatal mental health service. As is highlighted, there is no intention for the perinatal mental health access metric definition to be amended at this time, and they stand by their clinical rationale for that. However, they appreciate that it would be still, can I go back up a slide, please? Thank you. They appreciate that it's important for us to capture that. And Jenny and I feel very strongly about this, as I'm sure many of you do, that we do capture those contacts that are happening via telephone call and why that may be. So, for example, if our women are giving us feedback, as we know is happening at the moment, in terms of why they don't want to do a video contact, then we need to capture that information so that we can still plug this with the national team and see if we can get any movement on that. And we appreciate that for some that might be frustrating. We were hoping that there would be a change in this. The current position is that it will remain, that they won't be counted, but let's count that separately. So that would be our request, that we ask you to do that. And happy to explore ways of doing that later on in the question and answer session if that's helpful. Next slide, please. Oh, so I've just been asked to repeat what I've said about telephone contact as there was a problem with sound. Can everybody else hear me? Are people generally finding it difficult to hear me? Okay, I'll just repeat that. Okay, I'll just repeat that one last time. So what we are asking is telephone contacts will not be counted by the national team in terms of your data, but we are asking you to collect that, or would advise that you collect that separately. And if women give reasons why they would rather have a telephone consultation as opposed to a video consultation, that you also capture that. Okay, it looks like most people can hear, so hopefully everybody has, and we'll move on. So a couple of questions and a bit of discussion at this point. So we are being asked by the national team whether services think they are still on track to meet the access target rates. And I guess one of my questions was, where are referrals for you guys? Have you seen a drop in referrals? Are they staying reasonably constant, or are you seeing an increase in referrals? And then another question in terms of how are you letting other services and clinicians know that your service is still open for business, how they can access the service online or via online, or also in terms of, you know, video calls and that, rather than face-to-face appointments and that. So if anybody wants to comment, please feel free either to put in the chat or take yourself off mute, put your video on at this point, and we can start a bit of a discussion. Any thoughts whether people think they are on track to meet access target rates, or whether there has been a change in referral rates currently?
Hello there, it's Helen Bloomfield from Hampshire Hospitals.
Hi, Helen.
Hello. Just in answer to that, I would say we've had an increase in referrals, mostly from our midwives coming in, and with regard to how we're letting other services know, it's a case of business as usual. So it's maintaining that contact with our local perinatal mental health team and GPs and such. So it's just continuing the normal activity is how they know.
Thanks, Helen. We've got so Joseph has said that Bucks perinatal referral rates have dropped on the chat. So we've got a mixed picture there. Berkshire on track to meet access rates. However, more inappropriate referrals. I think that, yeah, I'm sure others have probably had similar. Okay. We'll capture what's in the chat box. Anybody else who wants to comment verbally? Kerry's asking, sorry, carry on. Who's that?
Hi, Liz, it's Kerry.
Hi, Kerry.
I was just interested. Hello, everybody. I'm Kerry Clark. I'm the South East Regional Lead for Children's Mental Health. And I'm going to try and make sure that there is a connection between this work and the cell and the mental health cell and learning disabilities. But I will own that this area is quite new to me. I was interested in how people are finding it now that you're not having home births in the community.
So I think the position on home births is likely to possibly change in the next week or so. So certainly I was on a regional call yesterday, and South Central Ambulance are now in a position that they feel that they would be able to support home births, which was one of the big concerns. So that may well change. I don't know if anybody else is going to comment on that.
Hi, I'm midwife from Oxfordshire. Our home births have continued. We've been lucky enough to keep all our midwifery-led centres, bar one, open and home births. Ambulance services supported us well.
Super.
Yeah, so sorry, Liz, it's Jenny Hughes here.
Thanks, Jenny.
It's South Central Ambulance has been supporting home births right through the COVID. It's South East Coast Ambulance that 3 weeks ago stood down their support to home births. So that's been a factor in the home birth situation in the south, in Kent, Surrey, Sussex, where the majority of the home births are suspended.
Thanks, Jenny, for clarifying that. Any other comments? Otherwise, we'll move on to the next bit and we can come back to this as part of the collaboration session. So I just wanted to invite Abby Applin, who's going to give a presentation. Thank you, Abby, for joining us today. And this was as a result of direct feedback that we'd had from the last webinar. So we felt it was important that we covered that, and Abby could give an overview from the RCM. Thanks, Abby. On hand over to you.
Thank you. Good morning, everyone. Thank you for inviting me to have a chat this morning about this. So obviously what we wanted to really say was our priorities initially was obviously the RCM's prime business is promoting, supporting and influencing and making sure we have safe services across the country, which is obviously a priority. For us, that hasn't changed, and I think really a lot of the work we've been doing is about keeping services running, supporting people with decision making, and making sure that the women accessing the service know that the business is as usual. Women still have babies. It's really important that we continue those services. So if we just click to my first slide. So what we've tried to do with the information that we've been giving out to women and staff is to centralise that information on our webpage, but also to work really collaboratively with not just nationally but internationally with people to gain the evidence that we could to produce the documents that have been produced so far. So I think, as you can see, with the coronavirus infection in pregnancy guidance that's been produced, we're on version 8 already. And I know it seems like amazing that could be happening so quickly in such a short space of time. But I think it shows the changes to the information coming in as we're gathering it from international sources and the experts across internationally and nationally. So I think to be involved in that is really key. And I think the important thing about it for the RCM is showing the collaborative working that we've been doing and forging those links over the last couple of years, which has been really, really important for us. So we've tried to be the source of information that's totally evidence-based as much as it can be, and to get out there in a timely manner for people, which obviously is frustrating when another version and then another version comes out. But, you know, I don't think we can apologise for that. I think it's just important that as it changes, we update our information. So we've been really keen to emphasise the importance of ring fencing maternity services as a frontline service and making sure the midwives, especially the specialist midwives, stay in their posts, particularly about perinatal mental health, you know, all the safeguarding posts and things like that. It's really key for us that they're in a position, as much as people, you know, we want to support the other services given the pressures they're under. I think it's really important for our women to remain safe, and for our staff as well, so that they're also in the field that they're experts in and they can continue the great work that they do all the time. I think the ring fencing has been quite successful. We're pleased about that, and we'd like that to continue. keeping services running and making sure women know about the services that are available has been really key. And we've been trying to get the best we can from the media outlets we can to get that information out. We've been really grateful for the partnership working across the whole of the social media fields as well, with people taking up our messages and making sure they get out to the women to make them understand that we don't want them not coming into services, that it's really important that they carry on with their care. The antenatal appointments are really key, and basically what maternity services have done, as you all know, is just do it in different ways. We know face-to-face communication for midwives is really, really, really important, but this time we have to do things differently during this coronavirus episode. So I think the fact that people have changed services overnight has been absolutely incredible. Obviously, the vulnerable are the people that often don't access the services. So I think those specialist midwives still being in post, able to follow up those people, make sure they are getting the care they need. It's really important. Obviously, there's been issues around sickness absence within maternity services, and we know that, and I think it's put a lot of pressure on the midwifery leaders out there to provide the services that we need. But I think they've done a fantastic job in centralising a lot of their services. Yes, some home births have had to be temporarily suspended, but as Jenny said, I think that's really variable across the South, and that is dependent not just on maternity services availability, but obviously the South Central ambulance services as well. So we're really keen for women to work with services and make sure that they know that the midwives are doing everything they can to provide the choices that they want. But we know that sometimes this isn't always possible. But we know there's been some issues about free birthing, and whether that's because of increased with people, not just anxieties about birth, but also not wanting to go into hospital because of COVID, but also they may be women that have had traumatic births before. So I think it's important that we absolutely work with them, sort of have conversations with them and gain the trust back again, so that we can make sure they do have attended births, because that's really key for us. So we're hoping to get a document out in the next couple of days, which is a professional briefing about supporting midwives and how to do that, which I think is really key. We've tried to do lots of questions and answers with the women on social media, which has been amazing. The responses and the questions that have come in have been great, and I think it's been an opportunity for us to use different ways of working as well, which I think we're all doing across services at the moment. But it has been an opportunity, and it may be going forward that those opportunities continue as we learn from best practice. Just on the screen in front of you, I've just highlighted some key infographics that we sent out to women and staff, really, because as much as it's a really stressful time for women, it's always a really stressful time for staff as well. So we've been trying to say that, remember your core skills, back to basics. And although that might, people don't think that might be a bit patronising, it's not about that. It's about, we know that when you're in a stressful situation and you're caring for people and you're having to wear PPE, your mindset is different. So it's really key, we're really key to get people just to remember the basics and look after themselves as well. And for the women, it was very much about them understanding why things have changed and asking them to work with us to make sure that they are honest about their symptoms and to protect the midwifery staff and the obstetric staff as well. So that's been really key. So we just go on to the next slide. The key things we've done with how we support our midwives as well, it's about making sure that they get the right equipment that they need with the PPE. We're really keen to get testing done for frontline staff, and that seems to be really taking off now. Jenny's team were updating yesterday, especially across the southwest. There's lots more testing going on because midwives want to go back to work. They want to be able to give the care that they're used to giving. So I think that's really important. I think the RCOG has done a great job in getting the information out there to women about the services that they've got. And I think including in that is care of our pregnant midwives, which has been really key. And that's changed as the information's gone along. So now going forward, what we really want to do is support the carers as much as the women, and all the information that is out there, obviously, and will continue to be updated as we need it. But we're really seeing that the midwives need that support now, and support workers, all maternity service givers really need that support now, and we're trying to get more information out onto the webpage for them to make sure we're looking after their mental health, and obviously working with the Royal College of Psychiatrists as well to so that we've got up-to-date information. Let's use their information that they've got to support our staff. So we're very much directing our own members to be utilising the prompts that we've got on the web page for them, and it's very much about signposting them to help, and that goes for both women and the midwives at this time. So it's really key. So the Caring for You campaign was something we started some time ago, and that's very much taking off now as well as we move towards International Day of the Midwife, which is a bit strange to be thinking about that already. But you know, at the end of the day, we should be celebrating the great work and the successes that midwives have had during this time as well. So that's work ongoing. As far as protecting perinatal and mental health services, and obviously the domestic violence, we're doing some work at the moment because we obviously are aware of the increases in domestic violence contacts and the sad stories that are coming out from that. So we're also doing a piece of work on that. So I think continually we've got an expert reference group working on getting information out there to services, because we know that they're obviously concerned about women's health during this time, not just their maternity health, but their mental health as well. So continual work going on, and we've been very lucky to have a expert group of midwifery professors working with us as well, which is absolutely fantastic to be able to use their resource. So we're hoping that the information that comes out will be useful going forward. So I don't know if anyone's got any questions.
Thank you, Abby. Any questions for Abby? Don't forget to unmute yourself.
Hi, Abby. I've got a question, if that's all right. So that domestic violence work that you're talking about, when are you hoping that the findings for that will be released so that our systems will have access to it?
It's really early days at the moment. Somebody's just taken on the lead for working on that. We've obviously got our policy group, which obviously would have always been working on the vulnerable women and domestic violence, been part of that. But it's work that's just really taken off now as a response to the information we've been able to get so far. So I can't give you a timescale on that, but as with everything, we're hoping to get things out as quickly as possible, as you can see from the work that's been done already. But I can come back to you on that one.
Thank you. Any other questions for Abby? No. Okay, thank you very much, Abby. We'll move on. There's a whole list of links and resources that Abby's kindly given, and obviously they will be shared in the slide set, and we can come back to any further questions later on in the collaboration session. Thank you, Abby. I'm going to hand over to Jenny now, who's going to introduce Home Start. Oh, sorry, can we just go one up again? Just to remind everybody, obviously there are various, as Abby's mentioned, various publicity campaigns at the moment, including the Kicks Count, and just reminding women that when they do need to present, they should come in or contact midwifery services and come in for support. Thank you. I'll hand over to Jenny now.
Thank you, Liz, and thank you, Abby. That was really important and valuable presentation. Thank you. So I'm delighted to now hand over to Becky Saunders and Liz Rowe from Home Start, so that we can understand the Home Start offer during these strange times that we're living in. So thank you, Becky.
There we go. Can you hear me now? I think I was still on mute.
That's better. Yeah.
Okay. Just saying good morning, and thank you very much for inviting us to join you in your webinar. It's really great to be working in partnership at the moment. So I'm going to give a bit of the national picture, and then my colleague from one of the local Home Starts is going to talk in a bit more detail about what they're doing. For those of you who don't know, I suppose first of all, actually, I'll just introduce myself. So I'm the lead for policy and development for family mental health at Home Start UK. I'm a child and adolescent psychotherapist and used to work in Oxford, which I'm sure many of you will be familiar with. So I was a specialist parent-infant psychotherapist. In my role at Home Start UK, it's very much about supporting development of the perinatal work around the network. So, as I said, for those of you who don't know Home Start, we're a federated network of around 180 local home starts across the UK, supporting something in the range of 27,000 families. We have around 13,000 volunteers working across the UK. The Home Start's been going since the 1970s and is very powerful, I think, in the sense that they're very localised. Each local home start is an independent organisation, so they're very rooted in their communities. They're very responsive to the needs of their communities. But as a network, we've got this ability to collaborate and to share good practice across the network. So I think that's a really powerful combination. At the core of the Home Start offer is volunteer home visiting. Volunteers are all trained and they have a 10-week course of preparation. Actually, do you want to put my next slide down? Thank you very much. So the volunteers will typically visit a family for 2 hours a week for many weeks and months, going and seeing that same family. And the volunteers are very carefully matched with the families. As well as this core offer of volunteer home visiting, many of the local home starts will do groups. So many of our home starts are offering groups for mums and for dads experiencing postnatal depression or anxiety or around perinatal mental health. And many of them also offering sort of parent-infant groups too, looking at the interactions between parents and their babies and supporting attachment relationships. They also offer other activities. So at the moment, particularly, we're working very closely with food banks. We're signposting, so at a national and a local level, absolutely sort of giving that message that support is still available, albeit in a different way, and trying to collate and make, present that to parents in a coherent way. Many of our local home starts will also offer more specialist activity in the sort of perinatal space. So that might be breastfeeding support or something like video interaction guidance, which some of the local home starts are offering. Could I have the next slide, please? So this was from a survey that I did at the end of last year when I was mapping the work in the perinatal period, and we're including up to age 2 in that, so very much in the sort of first 1,001 days. And you can see that by and large the offer that's being most frequently given by local home start is enhanced home visiting. So that will be home visiting where the volunteers have had additional perinatal mental health training or parent-infant mental health training and ongoing supervision and support with that. Can I have the next slide, please? Home Start's very much a holistic offer, so we start with the relationships, and it's very much based on the relationship between the volunteer or the member of staff and the family that they're working with, and building up that trusted relationship over time. And we'll address many things. So it might be around practical issues, it might be around signposting to services and supporting parents to access those services in the community. So often we're working with families who wouldn't typically access services, so we can be a bridge into to more specialist services. Or sometimes we're sort of in a stepped care sense. We might be receiving referrals from perinatal mental health teams, once their support has come to an end for a family, and they might refer on to a local home start. Some of the work that the volunteers will do with families is around things like family budgeting, supporting them in thinking about their child's behaviour and noticing what's going on with their children and being curious about it, establishing routines within their families, and very much about supporting early child development. Could I have the next slide? So I've just popped this one in there. This is from Greater Manchester, but just to give you, although there's a range of ways in which the local home starts are working in partnership with perinatal mental health services or the perinatal pathways, Greater Manchester is very much embedded and integrated into the perinatal mental health pathway, offering support to mums and to dads. They have a very good dads service there called Dad Matters. Could I have the next slide, please? So just to talk a little bit more about specifically how we're responding to the COVID-19 situation in this current period. We've surveyed all of our local home starts, and absolutely the majority of them have moved extraordinarily quickly, and they're doing absolutely amazing work in switching to remote working, in making use of new technologies, in continuing to offer support to families who are already on their caseloads. So oftentimes that's volunteers continuing to have weekly contacts, or sometimes more than that. And in some instances, contacts might be 2 or 3 times a week, or even more. Very many local home starts are continuing to take new referrals, and I'll show you at the end how you can find your nearest home start. Obviously, they're all charities. We know that the third sector is going to take an enormous hit because of the current situation. So the local organisations are having to balance that focus on being able to sustain their services where there's been drops in funding alongside a crisis response, and they're working in many areas in partnership with local mobilisations of volunteers or with statutory services. At Home Start UK, so it's a national level, we're again trying to keep abreast of the very fast moving guidance that there is coming out of organisations such as the Royal College of Midwives, and very much promoting that message that it's important for people to attend for appointments, and trying to signpost parents to trusted sources of information. We've been developing guidance very quickly around the safeguarding concerns that there are at this time, particularly as many vulnerable families where there's an offer for the child to be in school, that's not being taken up. So we're working with children's services and in partnership with local home starts often in developing guidance and thinking about the role that we can play in that. And as well as that, we've been developing guidance on online safety and just on using digital technology. Could I have the next slide, please? So like yourselves, we've very quickly moved to a programme of webinars on a whole range of issues. So just next week, we've got a webinar across the network on perinatal, on what's happening in the perinatal mental health, or supporting women in the perinatal period. So that will be joined by, that's for local coordinators or family support workers. And we've got a specialist clinician joining that. And it's really just about sort of sharing good practice, identifying the experiences that families are having, and being able to respond to that and just sort of learn from one another. We're continuing to post information on our website, so I'd encourage anyone to look at that. And again, on our social media platforms, and very much about, as I've said, about promoting evidence-based and trusted sources of information. We're at a national level, we're monitoring the need of local home starts. Again, that sort of focus on making sure that they're still functioning well and are ready once we come out of this situation and things change again. And recognising, I think the sort of feedback that we're getting from families is, I would echo what people have said here earlier. It's levels of anxiety and people's concerns about their mental health are increasing, and we're seeing that alongside increases in domestic violence. Many of you may have seen that there was a joint statement put out by the 1001 Days movement. So I was part of forming that, and it's really at a national level to try and keep the issue of families and of babies, parents new parents and expectant parents in the minds of policymakers and government, and to be championing that voice at this time. At the moment, we're working. We're putting a survey. It should go live next week, and this will be a survey open to all parents in the first 1,001 days, and that's really to gather up their experiences. So I'd be delighted to answer any questions that you've got on that. If you'd be happy, if it's something that you feel interested in, the kinds of things that we're going to be looking at in that. But we've got some of the information that we'll be gathering is around parents' experiences of care in the perinatal period. Could I have the next slide, please? So I've just to sum up really, if you go to our website, and I've given you the link to Home Start UK, there is a search function there. You can see how many local Home Starts there are. You can search for the local Home Start either using the map or alphabetically, and then you'll get the contact details. As I said, many of the local schemes are continuing to take referrals. We've got numbers of schemes in, as I'm sure many of you will know, across your region, and they are working very hard and doing very, extraordinary work, which you'll hear more about from Liz in supporting families at this time. So whether that's delivering equipment that new parents might need, whether that's vouchers for food or supporting deliveries from food banks, or just ringing and maintaining that important contact with families. So that's just a sort of whistle-stop tour really through what we're doing at a national level. And before I hand over to Liz, does anyone have any questions for me, or we can save those until the end?
Everyone's really quiet today, Becky. Not sure why.
That's all right. So shall I hand over to Liz then, who is a scheme manager from one of our local Home Starts in the Crawley, Horsham and Mid Sussex, and she's going to tell you about what they're doing there.
Good morning, everyone. I haven't got any slides. I'm just here to tell you a little bit about our local situation. So it's not going to be directly relevant to everybody, but as you are aware, there are lots of Home Starts around. My scheme is based in the top end of West Sussex. We cover actually about 46% of both the population and the area of West Sussex. And that incorporates two areas of mainly rural, but a massive development called Crawley up near the Gatwick Airport area that is very much urban. And like many areas, it has its massive differences. So in Crawley, we've got about 20% BAME communities, whereas in the other two areas, it's more rural, white British, maybe affluent as well. So we cover a very wide area. There are two other areas in West Sussex. There's one that covers the coastal area, and there's one that covers Chichester and District. So between the three of us, we're covering the whole of West Sussex, and that's common. There are areas around our area in the southeast and the southwest where you'll find there's some schemes that are covering very wide areas and some that are covering much smaller areas. So we're all working in roughly the same way as we are affiliated to Home Start UK, but we also have our differences. So what one scheme may be offering, another scheme next door may not. And that's because we're responding very much to the needs in our own communities. And for example, there might be something in my community already being provided by another agency. So therefore, we don't need to look at that as a need for ourselves. Whereas in other parts of the country, a Home Start may well be involved in that. In my particular scheme, we've got about 7 part-time staff, and we're looking after about 45 volunteers, which is really excellent for our situation at the moment. They come from a very wide background. The basic premise is that we're all parents, so that we can all empathise with the highs and lows of family life, which means that parents accept us on a slightly different level, and we don't pretend to be experts, although we have quite a wealth of skills within the scheme. not only in staff who are skilled in early years, play work and that sort of thing, but also in our volunteers. All volunteers work in a non-judgmental, confidential way, and some would class themselves as just mums with experience. But we've also got volunteers who come from nursing backgrounds. We've had midwives, we've had health visitors, we've got people from education, psychologists, and also people from early years. So we have a massive amount of skills with the volunteers that we have, let alone anything else. So as Becky's just said, all of our volunteers go through a preparation course, which is very thorough, and they've already been DBS checked, and we have to take references, and they do an interview. So it's a very thorough grounding before we allow any of our volunteers near a family. Normally our services, as Becky was saying, is our home visiting, and that is really important, and it's something that we're actually missing at the moment, not being able to get in alongside the families, as many of the families have practical issues that only someone going in can help them deal with, such as helping them get sorted out so that they can get the children out, helping them with routines by actually drawing things up and helping them physically and modelling and that sort of thing. As long as they've got a child under 5, we can take on referrals as long as we have the resources available to cope with that family. We have to bear in mind that all of our families are being supported by volunteers, albeit very well trained and very well supported volunteers, but they're volunteers nonetheless. So we are very careful how we match our volunteers. When we had finished, when we had to withdraw from physical contact with families, we as a scheme were running 4 groups. 2 of them were for families with multiple births children, so twins, triplets, and people were coming along at quite an early stage there to get the peer support that they found really useful and get the additional volunteer support within the group. We were running 1 group for young parents, usually the young mums coming along, which started in a supported housing accommodation for young mums, and has now moved out into the community. And then we had 1 group that we were starting in response to needs of parents on a new development where there was massive need, lots of new families and nowhere to meet. We just got that started when we unfortunately had to postpone it. So we had to make a rapid change in direction. Home visiting and groups was something like our bread and butter, and like every other organisation, we had to really rethink and restructure quite quickly. So all the staff are now working at home. We're in constant contact with our, we're in constant contact with our volunteers, and all of our volunteers are maintaining ongoing contact with the families that they were already supporting. Our group workers are also supporting the families that were attending their groups, giving them regular contact. We've set up Facebook groupings as well for the different groups so that people can come on and share their concerns. We've got our group workers posting daily onto a Facebook page so that families can look and see, by example, because both these group workers have got children, what they can do with their young children that day. Very, very simple things, but just giving them ideas. So the families that we're supporting currently are obviously coping with difficulties that they'd already got. So some of them are on early help, child in need, child protection plans. So safeguarding is really important. We're working very closely with the early help teams and as necessary with children's services. The early help teams are doing a tremendous job seeing the children and ensuring that they're okay. We are backing them up in that as we can't get into the families to actually see the children, but we're making sure there's contact. As Becky was saying, we're trying to ensure that children are going to school if they've been allocated places and trying to tease that with parents and liaising very strongly with outreach workers and things like that. We are also aware that some families are really now starting to struggle. It's as if they managed to cope quite well initially, but the length of the lockdown is really starting to get to people. We were talking to a mum yesterday who had a traumatic birth 2 years ago now, and we had some home visiting with her. She then went on to one of our groups and has been managing really well. But now the reality of being in lockdown, not being able to go out, is starting to affect her, and the trauma of her birth is starting to come back. So we were acting as a containment, as we work with the Solihull approach, trying to help her and contain her, feedback to her that we were listening, and also keeping a very acute ear open to see if there was anything more significant and that we needed to take further and to help her refer on to. Young mums that we were supporting have been reaching out to us. Without a lot of contact in our group, they're now starting to struggle a little bit with managing babies and very young children at home. So we're able to give them some ideas, point them to our Facebook page, and they are linking in to get that ideas there. We speak with them weekly and send texts as appropriate. And we've been trying to find resources and stuff for them. So in our office, we've got lots of resource packs that we've built together. We've got a Babble pack, which our speech and language therapist trustee helped us put together, which we're sending out to help mums keep going with that really important first steps of conversation building. We have some sensory packs, Gloop and things like that we can send out. We've also got craft packs, jigsaws, nursery rhymes, story sacks, all sorts of things that we are starting to get out to families to help them manage the situation they're facing. Obviously, some of them are finding it really difficult to manage financially, which is obviously also impacting on how they're managing. So we've been able to access some emergency funding, and we've been supplying families with some basic essentials. It's not just food. It's things like nappies, baby milk, cleaning equipment, that sort of thing. We've got some volunteers and some members of staff that are able to drop them round to relevant families, and they've been very, very welcome. Obviously, we are also in contact with families that, because of the close down and because of lack of finances, are also finding that their children are growing out of things and that they are looking for equipment that they don't have currently. Very recently, we've linked in someone who wanted to donate a pushchair that came to us by telephone with someone who needed a new pushchair. We've been very careful with taking it away, with social distancing, with keeping it to one side for a period of time, that sort of thing. We're trying to be really careful with that. And we've also been supplying some baby items that we've had in the office for some time. We are currently still accepting referrals. We have volunteers who say they're stuck at home, they've got nothing better to do, they're not doing the home visiting, but they would really love to support more families. So we have capacity at the moment, which is absolutely brilliant. Our volunteers have been amazing. Some of them are having to self-isolate, but they're still supporting the families. We're able to take referrals from families maybe that have had traumatic births and just need someone to talk to. We've supported them in the past with people that have had infection issues, with people that have had ongoing issues as a result of the birth, and with people that have struggled to regain some sense of normality, I suppose. So we can certainly offer a listening ear for that. we are able to offer, as I said, some containment to people who are starting to struggle. We have a really good supervision set up. We are still in contact with our volunteers, so if they have any needs, then the staff member is there all the time to be able to listen to them and contain them. And the staff themselves have six weekly still supervision. So we feel that we can manage an increase, although we would want to ensure that if any indications of a deterioration were there, then the referral would be available to be able to either take that back or direct us on for further help. I think that's about it, really. Obviously, our ongoing work is around routines, behaviour management, suggestions for play, and how to encourage parents to maintain that development of their children that's so necessary. We're just doing it in a very different way. Thank you. I don't know if anyone's got any questions.
I just wanted to say thank you so much to you, Liz, and to Becky for that presentation. And I know everybody's a bit quiet today. I'm not sure what that's all about, but hopefully it's because we're just being peaceful and enjoying the presentations. But I'm just so impressed at the way that you guys have adapted to COVID, and it must be a great comfort to families to know that you're still there. And it's really good, I think, for the people on the webinar today to hear about all the great stuff that you can offer. So thank you so much. And yeah, if anyone does have any questions, now's your opportunity.
Thank you for the positive comments.
Yes, there's some lovely comments in the chat column, even if people are quite quiet today, as I said. Okay, well, we'll move on then. Thank you. So we've collated some slides from the last webinar, just to show you that we have been sort of acting on the feedback that we got. And I don't think I need to go through these individually. It's just for you to read through if you're interested in any of the points, to know that we have been acting on your feedback and we have tried to find answers. I remember I said at the beginning of the first webinar, we absolutely will not have all the answers, but we will endeavour and try our hardest to find them for you. One of the things of note is about resources, and I know there's a huge tsunami of information at the moment. So our plan is to collate all of the resources that are relevant for you, and collate into a sort of easy to use way. So we'll be looking for some feedback on that, because once we've got the resources collated, we can put them on the website, and then we just have to add the individual updates from the various Royal Colleges and things just to keep it up to date. Okay, thank you. Next slide. Thank you. And again, these slides are similar in that this is some of the feedback that we had last time from people, just showing different ways that teams and individuals have coped with different challenges. So you've got the contact information there as well, and if you want to, we can put you in touch. Can we go on to the next one? And this is more of the same, some of the feedback from last time. You'll see that there's been some information about, because we're all using the phone more now, so there will be some resources in the pack about telephone work that there's a really good resource from the Institute of Health Visitors about telephone work, which I think is relevant to all health professionals, not just to health visitors. And there's also a really good template from the Dorset team. So a template for telephone consultations, but they've made it COVID specific. So it's much more holistic, and they're looking at, you know, do they have food? They're having talks about social distancing with people, reminding people to stay at home. So I think that's a really good resource to have a look at if you get a chance. Okay, next slide, please. In terms of sharing information, this is some local solutions that people gave us last time. So we'll have these on the website as well, so that we can you can refer to them at your leisure. Okay, next one. Okay, so we're now going to have what we're calling a collaboration session, and this is an opportunity for you to tell us anything that you might be particularly struggling with at the moment, anything that you felt you've had a big success with and you think it would be important to share it with other teams. And also remember that our speakers are still with us from earlier in the webinar. So if you've thought about it and you have some questions for Becky, for Liz, or for Abby, now's your opportunity. So let me open it up to the floor, so to speak, and let's see what you want to share today.
Hi, I'm Pauline Bigwood from Surrey.
Hi, Pauline.
Hi there. I haven't got my photo on, but I'm going to say a huge thank you to Home Start, because it's been really good to get an update. And I know that we are now linking in with our Home Start team who are in Epsom, who are looking at a virtual group to support parents. And that's a really exciting initiative to take forward. And we're really glad to be in partnership to support them. It's really made me look at each of our sites and to see how we can go back with our teams and talk to our local Home Start teams and ensure that we're all also signposting and helping each other. So thank you. That's really sort of spurred me on to take that forward today as well. I'm also, I can't remember what I was going to say now. Interested, there was a slide that said one consultation as a virtual platform. We use Attend Anywhere in health visiting now moving forward. I don't know what one consultation is.
I'm not familiar with it, but I'm guessing it's another digital platform. But if somebody out there that uses it can tell us.
Yeah, we use it in Berkshire Healthcare for health visiting and all over Berkshire Healthcare. It is just another platform, but it is very secure, where clients and patients wait in a waiting room and can then be brought in by the professional that actually is facilitating that contact.
So is that just, it's on a one-to-one basis? Because we're just looking, Attend to Anywhere, I think, is only one-to-one, and we're just looking at how we go into the group, a secure group.
No, it is also for groups as well.
We've been using one consultation for multiple professionals and one patient. We can only seem to get one patient at a time with those consultations, but we can have 2 or 3 professionals talking to that client. We are having to use Teams, and it's going through our Marcoms to approve that for having a compassion focused therapy group. And I think we have 5 patients and sort of 2 or 3 professionals on that.
Okay, thank you. It's just really interesting to hear what platforms people are using. I know we're within work, we're using Microsoft Teams, which has been fantastic. And as I think one of your slides said, it has really brought many of us together and been a really valuable tool. But for parents, yeah, I'm just looking at what's best to go forward for if we want to do virtual groups.
Has anyone found any other solutions to the group question with a digital platform?
Paulette here from Surrey Heartlands. I know that we're also exploring various digital platforms, and there's something called Visions. I know someone's mentioned that within our team. So we're also looking at that in terms of safe platforms and whether we could use that for clinical settings in terms of group work. So we are still exploring the various ones out there, definitely using Attend Anywhere as well in the midwifery services. And I know there was talk about Zoom, but there's some concerns about security, so that's not been taken up as much as some of the other channels. But yeah, ongoing work, but we're just still exploring some of the best ones out there.
Yeah, thank you, Paulette. I know Zoom is definitely we're not using, and I think at the moment we're looking at can Attend Anywhere is definitely for one-to-ones, but can we take it exploring it for groups?
Does anybody have any feedback on the webinars themselves? How people want to proceed? Because we're still happy to go fortnightly if that's helpful. I see we've still got quite good attendance today, so the fact that there's an appetite for it makes me feel this is useful. But do give us the feedback. And are you happy with this format, so that we'll have some people presenting on various aspects of life under COVID, and then something a little bit more interactive? So lots of people aren't talking to me today, but we got lots of lovely feedback in the chat. So it's looking just on a quick glance that fortnightly's working for people. If you have any suggestions about what you think the focus should be, for next time, if I tell you what we were thinking about was domestic abuse, because obviously we're all terribly concerned about that at the moment with lockdown. So whether we had a focus on domestic abuse and safeguarding next time. Does that sound like a sensible suggestion at the moment?
As well, in terms of just about the impact on them and how they're working with clients in this current climate, and what they can bring to the table really in terms of just contributing about user experiences, but also just to gauge, how it's been received in terms of what we're doing, and are there any gaps in terms of the service provision. I know that we're working very closely with our MVP in Surrey Heartlands, but I think it would just be useful to get an overall picture across the patch really as well, and we can share ideas with other areas and vice versa. Thank you.
And it looks like domestic abuse is a popular choice for next time, which is great, because that gives us time to set something up. And then in terms of the resources, does what I mentioned earlier about us collating the stuff that's coming in and then making it available to you all, but putting it in sections, so that if you're looking for something specific, it's a bit easier to find rather than having to troll through a list or a link that takes you to a massive list. We're just trying to make it easier for everyone to navigate and to save people some time. Excuse me, I'm going to blow my nose. Yeah, to save people some time in trolling through loads and loads of resources to try and find what you want, because I know loads of stuff's coming out at the moment, and just hoping to be of help to everyone, that we could collate that, make sure you've got the latest stuff. Obviously, we don't have to wait for a webinar to send out updates. We can do those as they come in. So does that sound like a sensible system to people?
Hi Jenny, it's Elle here from London.
Hello,
I
Elle.
was just wondering, hello you. Are you using Teams channels to organise information? Because that's a really useful way to sort of have access to stuff, but in one place, and doesn't get overloaded. I wondered if you're using that in Teams now.
No, never heard of it, and I'll talk to you about that afterwards. Thank you.
Okay. Yeah, no worries. Just I use it, and it's really helpful for just organising the amount of information there is, and just you have little channels on different topics so that you can just go to each one, and it's all within Teams, which you're all on anyway. So if you want any pointers on how to sort of organise it, let me know.
Thank you. Thank you very much indeed.
No problem.
So it's sounding like domestic abuse is definitely a popular topic for next time. Also MVP has been mentioned, so we'll get our heads together and see how we can get that to work across this big patch that we're now covering. And we will sort out the resources as I said, and if for any reason you don't find it helpful, just feedback. But it's really good to know that you're still finding the webinars helpful. It's hard at the moment to always get a sense of what is helpful to people. I know you're so busy, but I think sometimes having a marker in the week where you know that you can sort of link in with people can be helpful in itself.
Can I just check? We had some feedback, and it was just from one individual that Wednesday morning was not good. And I appreciate that diaries and calendars are packed. Generally, is Wednesday good for people, or would you like us to look to moving to a different day? I think we recognise that whatever day we have it on, it's not going to suit everybody. So again, any feedback on that, please send our way.
Hi, it's Jane here from Frimley. I was just going to say that the idea of the sharing the resources in a kind of ordered fashion, because there is so much coming out at the moment, would be great, and it would be good if it was in a kind of format that we could then drop and paste on our own individual websites or Facebook pages. Yeah, thanks for doing that. I think that's going to be really helpful for us.
Brilliant. Okay. We would hope to do that as soon as possible, but we are checking all the links that we get sent to make sure that A, there's, it's good stuff on there, B, the links are working, and so it is taking time, because we're finding, even already some links are broken, all the rest of it. So we will try to get that out as soon as possible. But just bear with us, because I don't want to send out, nothing more annoying than when you're looking for something and then the link is not particularly helpful or doesn't work at all. So we'll try and make sure it's good quality stuff that we send out.
Okay, thanks.
Okay, we'll take in on board your comments in the chat box about best days. It's like Wednesday still is a good day for most people, and also thank you. We'll take on board comments about times. Unfortunately, we had to go slightly earlier today because we've all got a meeting afterwards, but we will try and accommodate the 10 o'clock start going forward.
And it has been a sort of verbally quiet day today. I hope everyone's okay. We're slightly early, but I think it's probably sensible just to call it to a close now, if everyone's okay with that.
Jenny, can we just go on to the next slide,
Sarah? Oh, forgot about the next slide.
Well, it's just really just a reminder that these slides will be shared after the webinar. And again, if you were forwarded the meeting invitation, please can you let us know so that we can add your contact details to the distribution list so you get everything sent to you. So the website is written down there, so please just jot it down or put in the chat that you were forwarded the meeting, and we'll make sure that we get you included going forward.
Okay. So am I okay to draw it to a close now, Liz? Is that okay?
Lovely, Jenny. Thank you very much.
So thank you so much to everyone for coming, and stay safe. We'll send stuff out to you in the meantime, but if not, we'll see you all on the next webinar, hopefully. Okay. Take care out there. Bye.
Thanks a lot, everybody. Bye-bye.